And, yep, it's just us and Roma.
Steve, I told the Jade that you will be riding the motorcycle, and he was so jealous.
Oh, hello?
Can you hear me?
Yeah, sorry, I was getting my fried chicken ready.
Oh, no. I already told Vijay that you're driving to Detroit on a motorcycle. And he was like, "Can I just leave you and then hop onto Steve's motorcycle?"
Well, I don't know. It depends on where we go because it might get stolen.
Oh,
But I have full insurance on it, so I wouldn't
okay.
mind if it gets stolen. But sure,
Oh,
depends on where we go and if it's gonna rain. I'm down for it.
uh, okay, all right, no worries. Yeah.
Hello,
All
hello.
right.
Can you just
Can you hear me there?
we can hear
Yes.
you.
I'm gonna
Oh,
hop
good.
over to Josh's side because I'm eating Popeyes over there. One sec.
Oh, nice.
Popeye.
Yeah.
Okay.
Okay. All right, I'm gonna hop over to Josh's side. BRB. Enrique.
Hello.
By the way, I hope they crop this part of the recording.
It's going to be on YouTube.
We're personalities now online.
I guess Josh is part of the YouTube channel forever.
The goal.
Hi, Enrique.
Hello.
Looks like people are still filing in, but if you want to give it a minute or two, and then you can start whenever you'd like.
Yeah,
Your screen sharing works. I think it did, right? You had your slides up before?
yeah, I was just doing a quick check.
Okay, yeah, that looks good. Yeah, so whenever you want.
Yeah, we can whatever if it's
I
I
think you
can
can give
start
it
right
another
away.
minute. Looks like people are still coming in.
Okay, very good. So we'll start with the talk today. So it's about sleep and supplements. And for me, it's really interesting to talk about this particular topic. Um, it has been to my attention that more and more patients have been bringing to the clinic, even in my days in family medicine, bringing in more and more supplements to the clinic and asking me, does this work? Is this good for me? Is does going to help me with my energy, sleep, overall health? I kid you not, I had a patient once bringing me 2 bags of supplements. He was taking all of them. Of course, he was taking so many repeat supplements, vitamin C, fish oil. He was taking huge doses of vitamin D. So it was a little bit of education, but most of the time, whenever they ask me about supplements and health, I tell them my first thought is like fish oil. It's like snake oil or things like that. I don't think they work other than vitamin D and bones. Most of the time, I cannot give a clear answer for some of these supplements. If it's not clear cut, maybe fish oil with hyperlipidemia or so. But I think as time progresses and with the just changing of times and with the most recent pandemic, a lot of these supplements um, were more noticeable in patients' cabinets. So patients want to be more, they are more aware of prevention. They want to take medications or supplements to be, let's quote unquote, more healthier. They want to avoid prescribed medications or big pharma. And of course, I think social media is playing a big role on pushing these supplements or energy drinks that can have all of these minerals and vitamins, but with no real research altogether. Um, so what's happening, right? You see it more and more. Overall, the supplement market has valued around $50 billion in 2022. And of course, this is, this is growing due to our growing patient population. Raising is patients are more aware of maybe preventive medicine, and also the higher demand for nutrition drinks. One interesting fact is that comparing 2020 to 2019, there was a 44 increase in sales whenever the pandemic was happening in the US. And comparing the UK, France, and also there was an increase on supplement sales. So you will see here 345 million in 2019 to 435 million sales compared in 2020. And in the same time, also UK saw an increased sale on those supplements. So this is pretty much the market value happening throughout the years. So we know it's around 50 billion. So it's just going to go up and up, and people taking more and more. And so what we need is knowledge about these supplements, and we need to know. I think have more research and a better education about it. And it divides here what is the more common ones, and the most common ones people are taking multivitamins. A lot of botanicals, a little bit of probiotics, but vitamin D and fish oil are one of the most common ones. So comparing age to the consumption of supplements, as you may know or may imply, as we get older, they take more and more supplements. So people 60 and over, and more in female patients, they're taking around more than 4 supplements a day. And as also it shows, the younger you are, in my age range, we don't take supplements that much. But as we get older, you get more and more. So what are the most common supplements? As we were saying, multivitamins is the most common that people take. In second place, you have vitamin D, and then you have fish oil in the third place. And then, depending on your age, range. Vitamin C, botanicals, calcium, B12, calcium may take over due to the age. So of course, after all this, we need to have more regulation with these supplements. Are they still selling us whatever they're saying they're selling us? One, and are there still, are there any benefit of taking all of this? And we need to have, I think, more regulation, but also pushing towards more research. So let's dive in a couple of these articles I was able to find online of the most common supplements people take and sleep. Mostly sleep, and of course, touching a little bit of sleep apnea and supplements. So let's start with, I think, one of the most common ones that maybe people have heard or have seen is picking up a trend, I think, in the past few years with magnesium. So overall, magnesium in sleep is not fully well understood. We know that it plays an essential role in the ion channels and conductivity in the neurons. It's also it's a natural antagonist of NMDA and an agonist of GABA, the regular sleep. So we know that overall we need around 400 milligrams to 420 milligrams in men and 300 milligrams in women, and we can take that magnesium through food, mostly spinach, nuts, and beans and rice. Now, of the supplements that people minerals, it's mostly deficient in the U.S. Magnesium is a big one. B12, vitamin D, and magnesium. If I have to pick of the things that people are not mostly deficient on, and that's pretty common. People ask me, Doctor, do you have low magnesium? I don't need to check you. Most likely, it's low, and it could be our processed diet most of the time, or the overuse of certain medications. Acid blockers, omeprazole and some PPIs that can block the absorption of certain vitamins and minerals. So one of the studies I was able to find about insomnia and magnesium was this in elderly population. So they did a double-blind randomized clinical trial conducted in 46 elderly patients, and they received 500 milligrams of magnesium, and that's pretty much what you find in the stores, and it's versus placebo in 8 weeks. And of course, they questioned the patients and measured the scale of insomnia, and after the 8 weeks. They noticed a significant increase in sleep time in patients. So it appears in this particular study that overall it will improve the subjective measure of insomnia and sleep efficiency, sleep time, and sleep onset in elderly patients. And this is the little table they supplied in their study, where the placebo group here, the placebo group, you see the total sleep time, it didn't change at all. You see maybe early so the sleep latency didn't change at all. Efficiency at all didn't change. And with the supplement of magnesium before and after the intervention of the magnesium, your insomnia severity index dropped 2 points. The total sleep time increased, and latency, improved at all overall. So overall, magnesium supplementation in elderly was beneficial. Let's go through one of the other vitamins that we normally see people take is B12. Overall, it's cobalamin. We know it's good for our nervous system. And normally we need
Enrique, you have an
Yes.
interesting question in the chat.
Oh. It's a funny thing. I was trying to find a study, seeing if they were measuring different kind of magnesium, but they didn't mention the types of magnesium they were in previous studies and other studies. Yeah. Because they say like glycinate or sulfonate. What sulfate? What was the one that was better? And people ask me that, and I couldn't find like, okay, this one is better than the other one. In this page, in this particular case, I need to find I will find the paper and I will tell you which one was it, but I cannot tell you which one. I can find here if I have all day in a moment. Okay. So we think that B12 it presents a crucial role in the synthesis of melatonin. So it may be a way that B12 may interact with sleep in our bodies, in ourselves. And we know that overall adults, they need 2.5, 2.4 micrograms. So overall, deficiency of B12 is really rare. And we see it more in people with diabetes, people take elderly patients, people, malnutrition, pretty severe, because we store that B12, mostly in the liver, so it takes a lot of time to get better. So normally when I see that deficiency, it's in patients who have not been eating well in many months. So it takes over a year to see it. So most of the time, high foods in B12, it's meat, oyster, liver, and you will have high amounts of B12 in those foods. So it's difficult if you're eating proper meals, to be deficient if you don't have a surgery or so for weight loss. So one of the sleep studies I was able to evaluate was these B12 levels in healthcare users, primary healthcare workers in Greece. They were measuring sleep quality and sleepiness and insomnia. They noticed that in 512 participants, overall, lower levels of B12 show a significant association with insomnia symptoms, specifically more in non-elderly, non-obese, and mostly in female participants. And sleepiness was more noticed in obese patients. Now, well, this is one of the studies I was able to find. So when I saw this, I was like, oh, it's pretty conclusive, it's B12, low B12, more worse insomnia, and so on. Now we saw this other particular study that they actually this actual study in China, in patients with diabetes and association with B12 and insomnia. They mentioned the opposite, where they were examining 418 patients with diabetes with and without insomnia. Of those patients, around 24% had insomnia, the people who have diabetes, and they noticed actually higher levels of B12 on patients with insomnia. So upon further reading that article, I noticed that most of the patients who had insomnia, they also had severe peripheral neuropathy, and they were taking another supplement like B12 supplement. So I don't know why they actually came up with this study, because I think it's unreliable saying that they were taking the B12 supplementation in a regular basis to help with their peripheral neuropathy. So, and a lot of the studies I was reading about B12, they mentioned this study, and they couldn't fathom why it was high in those patients. But upon further researching, these patients were taking a supplement of B12. So I don't think, I didn't like it at all, but I wanted to show it. There was a particular case on a patient with a case report I was able to find with B12 deficiency, where a patient was diagnosed with sleep apnea. It's a 71-year-old patient in 2006. At that moment, he was treated just with a mandibular oral device, advancement device. After some years passed, in 2010, his fatigue and sleepiness has worsened. A repeat PSG showed that he was having hypoxemia and needed BiPAP, different BiPAP, and different pressures. He was doing excellent compliance with BiPAP after a couple of months, but his sleepiness and fatigue was still noticeable by the patient. Further research and evaluation was performed to this patient, and they were noticed really low levels of B12. Upon actually replacement of B12, the patient noticed that his sleepiness and fatigue completely resolved. So it's a good, I think, a good scenario where even after CPAP compliance, I think further research on our patients, it's always advisable to be sure that we are not missing something else. And apparently, this is the only case reported that it have been shown in the past. So fish oil. So why fish oil, right? So OSA is associated with an increased risk of cardiovascular mortality and morbidity. One of the proposed mechanisms of OSA is an increased inflammatory response, right? An increase of tumor necrosis factor. And these patients will have higher levels of tumor necrosis factor. And in some of the studies, it has shown that CPAP can reduce that. It is thought that supplementation of omega fatty acids may decrease this inflammation and may improve, patients with OSA and benefit their overall cardiovascular health. So we cannot synthesize fish oil, and we cannot make it. We need to consume it, and the best way to consume it is with sardines, anchovies, salmon, and so on. And if you are unable to tolerate that, of course, use all the supplements and offer walnuts and other oils. Of one of the tests I was able to evaluate, trying to measure the omega-3 levels and compare it to how to your sleep apnea, comparing the levels on mild, moderate, and severe. Is there a correlation on this? So in a particular test done in 350 patients, after controlling the age, sex, race, and smoking, BMI, alcohol intake, even diet and fish or supplementation of fish oil during the day, they noticed that having for every one increase of standard deviation of fish oil or DHA levels, the patient was about 50 less likely to be classified with severe OSA. So the more you have of fish oil or the higher levels you were having in your system, it was noted that your overall OSA was less severe. So in this particular patients, they noticed that as your levels of DHA were higher and higher, your levels of the likelihood of having OSA was lower. But as your DHA levels was the percentage was lower, the likelihood of having severe OSA was high. This was kind of uplifting upon reading this particular study. But there was another study that, in this particular study, was in 2011 in Kansas City. This other study in 2017 in Germany pretty much did the same, taking into account 357 patients. They took into account smoking history, alcohol history, how much fish they were taking, if they are taking any supplemented over-the-counter fish oil. After all that, they divided the patients in mild, moderate, and severe, and see if there was any correlation of with the DHA levels in their blood and the severity of OSA, and they noticed no correlation at all. They think in this particular situation, there will be a possibility that the diet overall in Germany is a little bit better than in Kansas, because they do mention the Kansas study done a couple of years ago. So they were expecting something similar, but they may think maybe the regional component or even maybe a overall healthier diet could be a component in these particular patients, but they don't know. They couldn't have similar results. So another study testing different kinds of the fatty acids supplied to young adults and comparing sleep. It was done in young people. There's some evidence that's suggesting that fish oil improves sleep and sleep quality. This placebo-controlled double-blind randomized trial investigated the effects of oil rich in DHA or EPA and measured sleep quality in healthy adults who normally didn't eat that much fish. Overall, we think that DHA might specifically affect sleep regulation, including impaired functioning on the suprachiasmatic nuclei, altered melatonin release, and disruption of the endocannabinoid signaling. So overall, in animal models, it's revealed that fish oil can play a part in sleep and sleep regulation. So in this particular test, and that we were talking about with healthy adults, they grabbed 90 patients. Overall, 29 completed the diet with the supplement with DHA-rich oil. 27 completed the study with EPA rich, and another group was given placebo. What were the results? It is actually pretty encouraging, where we noticed that sleep efficiency and sleep latency improved compared to placebo with fish oil. Both DHA and EPA-rich oils were noticeably better compared to placebo, and also sleep latency was lower compared to placebo. A funny thing with EPA-rich is that the total minutes in the bed were decreased, and the total sleep time was decreased compared to placebo with the EPA-rich. Now, they also tested how energetic they were feeling after sleeping, how ready to perform, and they noticed maybe a little bit equally, or maybe the DHA was a little bit lower compared to the placebo. So not in that regard, not as beneficial. So overall, in regards with the EPA-rich oil, the trend towards significant increase in sleep efficiency was identified in this group compared to placebo. EPA-rich oil also resulted in significant decrease in both total sleep time in bed and total sleep time compared to the DHA group. It is think that the shortened sleep times identified within the current study following the EPA-rich oil as compared to DHA might potentially be explained by the role of EPA inhibited the formation of E2 series prostaglandins, which in turn inhibit the release of serotonin. So this may, keep serotonin in the brain and may promote wakefulness in these patients. So even though that overall the sleep latency and efficiency is better, maybe the time of sleeping is less with EPA rich. So overall, with vitamin D, turning a point, overall vitamin D is a fat-soluble vitamin. And we can get it in D12, D2 or D3, and normally D3 is produced in the skin after sun exposure. And overall, vitamin D, we use it for regulation of bone homeostasis. But however, it's implicated in other activities other than just the bone. We have identified receptors in the hypothalamus and help us with the sleep-wake cycle. And of note, patients with OSA and vitamin D deficiency share the same risk factors as old age, obesity, renal failure, and diabetes. In one particular study with vitamin D and muscle, they noticed that people who are consuming statins, they're at an increased risk of proximal myopathy, vitamin D deficiency, and statins. So reduced pharyngeal dilator muscle strength in vitamin D deficiency may be predisposed to apnea events. However, there are no studies evaluating the vitamin D replacement therapy and pharyngeal dilator muscle strength. but result from a systematic review of 16 randomized controlled trials on the effects of the treatment of vitamin D on muscle function supported a beneficial effect of vitamin D supplementation on muscle strength and function in the elderly. So there are no studies, seeing if overall apnea events improve with vitamin D, but overall strength may improve in the elderly with vitamin D. With vitamin D and immunity, we know that vitamin D it could be associated with vitamin D deficiency is associated with an increased autoimmunity and susceptibility to infections. So in this case, we think if people who are more deficient with vitamin D levels, maybe an increased risk of COPD, asthma, allergic rhinitis, and this may promote tonsillar hypertrophy and both and may increase the risk of OSA. So that could be another way that we can help our patients if we know they're deficient and we know that they have issues with asthma or allergic rhinitis. We can maybe always check for vitamin D. We know that vitamin D inhibits the secretion of pro-inflammatory inflammatory cells and also promotes the production of anti-inflammatory cytokines. So it will be beneficial in these patients who have OSA and are prone to cardiovascular diseases. In vitro studies have demonstrated that vitamin D inhibits nuclear factor Kv activity. However, in a double-blind randomized trial, including 54 obese adults, patients received a single bolus followed by a daily dose of vitamin D, and they were matching placebo for 16 weeks. There was no difference compared to inflammatory markers, even after adjusting for confounders. So in this particular case, even if in vitro showed a benefit, in these particular patients, there were no benefit in the inflammatory markers. In patients with narcolepsy, it was noted that in one study, they noticed that in 51 narcolepsy patients, and another 55 matched healthy controls, patients with narcolepsy group presented with a lower vitamin D and had a significant greater vitamin D deficiency compared to controls. And more in controls. But another study that tested other patients with narcolepsy, 174 patients, and 174 healthy controls saw no association with vitamin D deficiency. So it wouldn't be any novel way to diagnose narcolepsy.
Well,
Now,
the other thing is that, someone with narcolepsy may have different habits, and maybe they go out less and get less sun exposure. That could be another explanation.
Yeah, so there could be other confounders to the study.
Yeah.
Yes. So in a positive note, in a cross-sectional study in 180 patients, 81 patients who underwent PSG and were stratified on the severity of OSA and mean vitamin D levels, there was no significant difference between vitamin D levels between controls and OSA patients or among OSA severity groups. There was no correlation found between vitamin D levels and AHI. A double-blind randomized study, they also did a trial of a supplementation of vitamin D with 15 weeks and included 19 adults with OSA under CPAP and 4 with CPAP naive. And evaluated sleepiness, quality of life, fatigue, neuropsychological function by means of questionnaires. Overall, what they noticed in this particular study, that fatigue was significantly improved with vitamin D group. And they noticed that the lipoproteins, decreased fasting glucose, were also noticed that they've been decreasing in people who were supplied with the vitamin D. So as we going through these studies, there's a lot of I believe one range of the could be sexes, could be female male patient difference, could be the location of the study, where is the study done, is this when is the study performed. I think with supplements, it's really difficult to evaluate the improvement of these some of these levels and some of these results. And as I seen a lot of studies done in different places where they have different data. So it's difficult to give have a good consensus, a good result, I think. And so we have another study that with vitamin D, with 65 compliant patients and 25 non-compliant OSA patients who underwent CPAP therapy for 7 nights. CPAP treatment significantly increased vitamin D concentration in an entire OSA population. No change in the serum vitamin D levels after treatment was observed in the non-compliant subjects. So overall, patients who are CPAP compliant, we will actually increase in the vitamin D concentrations. More noticeable in males than in female in this particular study. The same group that they had a benefit on their vitamin D, they further on follow them after a year later, and they actually noticed the vitamin D went actually higher, and they were much better. And of course, it was much better in people who were compliant to the scarcely compliant therapy. So I think another benefit of CPAP is that with vitamin C, it's a water soluble vitamin, and we're unable to synthesize the vitamin C, so we need to consume it. Overall, we need around 90 milligrams for males and 75 for females, and it will go higher in lactation, up to 20 milligrams when you're for lactation. These are the most common foods that may have vitamin C. We see red pepper pretty high. We see orange juice. We see kiwi, right? One of the also really high will be jalapeno. All salsa. So you eat salsas, it's pretty good amount of vitamin C. Guava has a lot of vitamin C, and it's not in this scale. So I don't know how much guava we have here. In Mexico, we have a lot, but it has a lot of guava has a lot of vitamin C compared to oranges. So why vitamin C? Why will it be beneficial for sleep? So overall, vitamin C is a regulator of the neurotransmitter biosynthesis, and it plays an important role in the conversion of dopamine to norepinephrine, which is crucial for the regulating our mood. Chronic lack of vitamin C may lead to decreased norepinephrine levels and may have a negative effect on our mood, and so it could be affecting our sleep. Also has antioxidant properties that may play a role in patients who have severe OSA. In this particular study, investigating vitamin C in trouble sleeping, several symptoms associated to sleep were analyzed in vitamin C. Of the whole study of the 3,000 people, 29% had trouble sleeping. After adjusting for all the potential confounders, and for every unit of vitamin C increase, the risk of trouble sleeping decreased 18%. Another study associating vitamin C, physical activity, and sleep, also noticed that patients, the analysis included adults age 18 and above. They analyzed sleep duration, and they were analyzing the sleep, the duration, if it's less than 5 hours, 5 to 6, 7 to 8, and more than 9. They analyzed physical activity, overall diet, vitamins, and minerals. This particular study showed that overall, people who have a short duration of sleep normally have the lowest intake of vitamin C, selenium, and other mineral and other supplements. And overall, people who had an optimal level of vitamin C and other antioxidants had a better, higher sleep. So overall, shorter sleep, there was nothing to have a lower amount of vitamin C altogether. Another study in the UK, they analyzed the fruit intake in vegetables, and they noticed people who had the higher intake of fruits and vegetables had higher sleep, so better sleep altogether. And people who had much higher levels of vitamin C, they noticed that they sleep much more than 8 hours per day. If they were feeling, if they were feeling completely restored, I think it's a good point. But I think it's one of the things we tell the patients, eat right, eat a healthy diet, and overall we know that good diet and exercise will improve your sleep at night. But this is just evaluating also the levels of associated plasma biomarkers of vitamin C, and in these particular patients. Another particular group that with vitamin C show that overall the troubles of sleeping improve more in females, but it was not noted in males. So overall, the protective factor for trouble sleeping in female, but not in males mostly, and was much protective more in people who were younger participants, less than 65, than in people who were not linked above 65. So this phenomenon will be different in these particular subgroups, female and male, and more than 65 and less than 65. So going more into sleep apnea and vitamin C, in a particular study, they were measuring the levels of all these vitamins overall, vitamin C, A, E, selenium, and they think, of course, these antioxidant properties should improve overall the systemic inflammatory disease, and hopefully help these patients with OSA. Now, one particular study found that people who were newly diagnosed with mild to moderate OSA, they had overall lower concentrations of selenium, thinking that it's playing a part on that OSA, or newly diagnosed OSA. In this particular study, whenever they were measuring the groups, they noticed that overall selenium was actually higher in patients with severe OSA, and also vitamin A. They are thinking, is this a response body is doing to absorb more nutrients and compensate for the free radicals? It's a positive way to see it. But overall, it was more association of higher levels more than lower in severe OSA and vitamin A and C, vitamin selenium and vitamin A. One very interesting study I was able to find with vitamin C and endothelial function measured. They actually did a study measuring patients with OSA. They compared it with a group of subjects, the baseline flow mediated dilation in patients with OSA, and among the patients with OSA, the flow was neither related to the AHI or the BMI. They actually used 0.5 grams of vitamin C and evaluated the vasoreactivity in these patients. Whenever they tested the vitamin C in control groups, there was no change. But whenever patients with OSA were given vitamin C, there was a significant increase of the flow comparable to the control group. So this is the graph, and then this is the control group where this was the baseline of the flow of the brachial artery, and after the vitamin C, there was no big change in the flow. But if you compare the baseline to after the baseline patients with OSA, after the vitamin C, there was a good vasodilation. So it's difficult to say what is the level, a daily level. Is this going to, if patients have OSA, consume vitamin C, it's going to be a overall healthier for the inflammation and endothelial health. They don't know, but in this particular test, they didn't measure that, just not the chronic, not the long situation, but it was I think a very interesting case. We know, of course, that numerous studies have evaluating the relationship with oxidative stress and OSA. So the majority of them suggest the connection between the increase of stress and the disease, showing a strong correlation between the rise of oxidative stress markers and the fall of O2 saturation. In a particular test, patients were administered continuous CPAP for just 2 nights, and after that they were given vitamin C and E for 45 days. After that, they noticed that after the 45 days, the antioxidant treatment improved sleep, decreased Epworth, reduced the amount of apneas or AHI, and improved overall sleep. They think that overall, like giving vitamin C and vitamin E probably removes the inhibition caused by the oxidative stress to the excitatory motor neural discharge of the upper airway dilator muscles. So there could be a benefit in patients already on CPAP, adding these vitamins. There was another study, a couple of studies on RLS in patients with hemodialysis. And we know it's really common in people with end-stage renal disease, having restless leg syndrome. And on top of the common medications we're giving, if there's any other way to help the patients, and this is what they were thinking, maybe vitamin C, vitamin E may improve symptoms in these patients. And one of the authors, they did that for 8 weeks, giving vitamin C and vitamin E, and they showed great response. Similar positive effects were obtained by another author after the evaluation of vitamin C supplementation in patients with RLS and just in hemodialysis. Another test, instead of oral, they did intravenously vitamin C following the dialysis for after that for 3 times a week for 8 weeks, and they reported significant reduction of the RLS, improving on sleep quality, time falling asleep, and sleep latency compared to the patients treated with normal saline. So I think those 3 studies. There were 3 different studies comparing an RLS with end-stage renal disease. I think a good benefit overall. And lastly, you have probiotics. I think it's picking up, and more and more people are eating kombucha and things like that, drinking kombucha and eating all these new probiotics or buying probiotics. This particular study, it was a very comprehensive study, mostly done in rats, to see if actually changing the gut microbiome improves OSA and even sleep. We know that this biosis can occur whenever the microbes in their abdomen and in their gut are disturbed or changed. And that happens every time we take antibiotics, right? And it takes around 6 months or so, 3 to 6 months to completely go back to baseline. It could be that gut dysbiosis can play a role in OSA. So gut dysbiosis invokes the presence of harmful species of bacteria that are detrimental to the gut, that can induce leakiness to the gut, and those bacteria can transverse into the systemic circulation. Some of these toxins, like lipoporsaccharides, produced by gram-negative bacteria, can induce a state of local and systemic low-grade inflammation, shown in some studies. The episodic nature of intermittent hypoxia associated with apnea and hypopnea events can lead to fluctuation of oxygen in the gut. And these changes of oxygen can actually change the type of bacteria we have in the gut to mostly anaerobic. There are several studies notice that people with OSA and also sleep deprivation, even minimal, can change your gut flora. So most of they were analyzing people, rats, inducing hypoxemia, and they will put these rats in these chambers inducing hypoxemia and analyzing the bacteria. Most of the bacteria analyzed in these rats, they changed, and they were noticed to be Prevotella species. They noticed that these patients with induction of let's call it sleep apnea, and then with increasing a high salt diet, they notice a worsening hypertension in these patients. And in these patients, actually, these rats, they notice the amount of lactobacillus when decreased. It was one of the healthy bacteria in the gut. So most of the times, these bacteria, whenever this Prevotella and Klebsiella will increase whenever rats were induced to hypoxemia, and when this increase in the production of lipopolysaccharide increase, you can increase the level of inflammation. You can increase the tumor necrosis factor and overall increase systemic inflammation. In humans, a few studies have been examined for the association between intermittent hypoxemia in this biosis. One of the studies, they noticed an increased lipopolysaccharide binding protein levels in children with OSA. And a particular amount of these children with OSA suggests an increased translocation of this toxin into the circulation into the gut. In a small cohort of patients with OSA, mostly Prevotella bacteroides were noticeably increased in the gut of patients with OSA. And patients who had AHI of moderate and severe, Prevotella actually predominated. So one of the chambers that they were using for the rats, in a particular study, patients with OSA, they were treated with a pre or a probiotic. In this case, the probiotic, this particular bacteria, or they were given this high amylose starch that functions like fiber. They noticed that with both treatments, actually the hypertension and the damage from the OSA actually overall improved, changing that in rats. In another study, they were investigating the use of lactobacillus and the development of OSA-induced hypertension in rats. Treatment with lactobacillus prevented an increase in hypertension and modulated T1 and 2 cytokines imbalance, and also blunted the phosphorylation of ERK. So overall, improve inflammation in these particular patients. Another study found that lactobacillus treatment in obese mice exposed to intermittent hypoxemia for 15 weeks prevented cardiac remodeling and inflammation. In another particular study, they reported that glucose intolerance, insulin resistance, and increased adipose tissue inflammation and adipocyte size, reduced circulation levels, and in obese mice all improved after restoring the lactobacillus with the gut with lactobacillus strain. they actually noticed that people, the rats treated with this, reduce the fatty liver in these patients. Collectively, the data of these experimental studies show metabolic, neural, and cardiovascular benefits, which indicate the potential of therapy for patients already with OSA and overall inflammation. There was another study actually with fecal transplant in rats. They didn't do nothing in adults, where they induce OSA in this they induce hypertension and actually intermittent hypoxemia in rats. They grab the flora of those rats and put it in normal rats, and those patients actually got hypertension. And the other way around, whenever they had healthy rats and put the bacteria onto the patients with the rats with hypertension, OSA, overall there was some benefit noted. So it's kind of interesting. I think overall it is difficult to give a conscious give advice to some of these patients, because it can be difficult with all the amount of supplements they are. Overall, I think our thoughts of diet, exercise, a balanced diet and exercise is the most beneficial, a balanced diet. But I think vitamin C appears to be convincing in RLS, maybe in patients with OSA, maybe also improve sleep. I think there's also some convincing evidence that maybe fish oil works for patients who have issues with sleeping, maybe with sleep latency, maybe with insomnia. B12 doesn't appear that convincing. And vitamin D is somewhat inconclusive for OSA or overall sleep, mostly for fatigue was one of the studies that they noticed. In probiotics, I think they look really promising. I think it's more about what brand, how to take it. Can you actually do the same studies on adults than in rats? That will be really promising for the future. And of course, magnesium, it appears it works for adults. Well, thank you very much.
Thanks, Enrique. That was fantastic. Such a thorough overview. See if anybody has any questions. I think there was a little bit in the chat, but I think Jordan answered that. If anyone would like to unmute and ask any questions. Does this affect how you may consider treating your patients in clinic, especially if they're still having persistent fatigue or sleepiness?
I think if we are not, I mean, I'm a family medicine trained, so I'm whenever people come with fatigue and it's not sleepiness, we look for other answers. Is this anemia? Is this thyroid? Is this diabetes? I think it adds to. I think I was blessed that I work with a team of integrative medicine in the past. I didn't do all the testing they did, but I think every case is important, and just analyzing what's your diet. Be truthful to me. Is your diet pretty bad? Are you eating out a lot? I think it can actually change the way we do things, because overall it's difficult to have a healthy diet. It's better maybe that instead of taking a multivitamin, maybe you take just vitamin C if we're having issues with insomnia, or we know you have OSA and you have a horrible diet. It doesn't hurt. You will not get intoxicated with vitamin C. It's water soluble. Probiotics, right? It looks like promising in rats with OSA and hypertension. I will say, is it possible to change that? Is it something we can start taking a line or something similar? But I guess there's not much studies aligning hypertension. I haven't seen.
Great, thank you. Any other questions? All right. Well, thank you. That was absolutely fantastic. Great job.
Thank you.
Thank you, Enrique. That was awesome.
Thank you.